I'm pretty fed up working with insurance companies. I think that it's just gotten to the point where it seems like they almost obstruct care more than help people to get care. And I've just decided that for me, for my own sanity, and for me to still enjoy medicine, I just wanted to step away from all of that. And this Shero lets me have the ability to do that. You get all the results when you come into Shero on the same day. I'm doing something new that nobody's ever done before. I'm asking people to believe in me.
So today's guest is flipping the script on women's healthcare. Dr. Tisha Singer is a breast radiologist who's leaving traditional medicine to build something that's really bold. It's called Shero Imaging. It's a concierge breast imaging center designed to deliver same-day answers and peace of mind. So if you've ever felt frustrated by long wait times, confusing results, or just broken healthcare system, then this episode's for you. Welcome, Tish. I'm happy to have you on.
Thank you so much, Spencer.
We're going to have fun with this. So this is a pretty bold idea that you're coming up with here. And I'm guessing there's a story behind of why you decided to do this. And so can you kind of tell me the story behind it?
Absolutely. I went to medical school late in life. And so I became a radiologist later in life. I already had a bunch of children. Went out into practice, took a bunch of leadership roles. So I've been leader of multiple women's imaging centers and also head of a radiology department. And I became really disappointed in all of my leadership roles that it felt almost impossible to get done the things that I wanted to get done, whether it be adding new technology, changing, times and hours that we see patients to make it more convenient for them. With the amount of administration in large hospital systems, it's really hard to make the changes that you need to make as a physician to actually make care better. And that's what I wanted to do. So I decided that I was going to step away from the normal healthcare system, and I've done that over the past year. So about a year ago, I set up my own telemammography company. My telemammography company, I essentially read for places all around the country, but I spend most of my time giving my services to underserved areas that don't have access to breast radiologists. So I read for 80 different Native American reservations. I read mammograms for prisons, for women in the inner city who get their healthcare off mammogram buses. And it's just a way for me to directly provide my services to them. Then I decided that there were problems with that as well, and a lot of things that I couldn't control. So I decided to open my own breast center. And so for the past 6 to 8 months, I've been creating kind of this perfect concierge style center for women with cutting edge technology and with the kind of care that I've always wanted to provide. And that imaging.
That's so cool. And so when you say you still were seeing the problems, what were the biggest problems that you were identifying?
One of the biggest issues for women is that when they come in and get a screening mammogram and they have an abnormal result, they have to come back for more imaging. So that's when a screening mammogram turns into what we call a diagnostic mammogram. It's really hard for women, especially women who are struggling. They're working multiple jobs to come back for multiple appointments. And oftentimes it takes about 3 months to get a cancer diagnosis from the time of a screening mammogram to the time that they actually can come back for both the diagnostic workup and for the biopsy. And I think that's too long. I'm pretty fed up working with insurance companies. I think that it's just gotten to the point where it seems like they almost obstruct care more than help people to get care. And I've just decided that for me, for my own sanity, and for me to still enjoy medicine, I just wanted to step away from all of that. And this Shero lets me have the ability to do that.
Really cool. And it's amazing. It's a big step that you're taking. And this is really a unique model because I've talked to hundreds and hundreds of doctors now. You're the first one that's doing their own concierge imaging center. I'm not saying, I don't know if it's ever been done before, but this is such a cool idea. But this isn't something like I'm just going to go off and start my own practice. This involves a much bigger infrastructure, right? And so
Absolutely.
what was like the first step that you took to start building this out?
The first step, I really just started to think about what I wanted to offer and how I wanted my imaging center to be different than the imaging centers that were out there already. And most of that was how could I make care better and more convenient for women? So how could I take away all of the barriers that they had to get to that diagnosis quicker? And one of the things that we're doing is doing same day imaging results. So instead of waiting, sometimes women wait up to 30 days to get a letter in the mail to tell them that their mammogram is abnormal and they need to come back for more imaging. You get all the results when you come into Shero on the same day. If you need more imaging, that happens right on the same day. If you need a biopsy, that happens right on the same day. So essentially, I'm taking away all the time and all of the worry and all of the angst that women have between these visits. And we're just going to get things done in one day, get them the answers they need so that they can go about their life how they need to.
What do you think that means to a woman if they can save up to 3 months of uncertainty to really develop a game plan that day?
It's huge. I've had an abnormal mammogram myself, and the wondering between the time I went in for the mammogram, whether or not this was actually going to be a breast cancer versus it was going to be just fine. I mean, I had already, been looking for wigs to go through chemotherapy, but I wasn't there yet. And I think a lot of women go through that when they have an abnormal finding. They think immediately, I've got cancer. I'm going to have to get my breasts removed. What if I die? What if I leave my children? Cancer care really isn't like that anymore. It's we're able to really help women, and the reason why women get screening mammograms is so that we could catch cancers early and really do the things that we couldn't do 20 or 30 years ago. Having said that, I tortured myself waiting for these results and thinking about worst case scenarios, and this just takes that away and gives you some of the joy back in living life.
I'm guessing it's a little scary to go off on your own like this and, obviously taking some investment capital. But did
Yes.
it become a point where your frustration outweighed any fear that it took to actually take the step to doing your own thing?
For sure. I mean, I am terrified. It's the unknown. I'm doing something new that nobody's ever done before. I'm asking people to believe in me and to believe in my imaging center. I'm taking a huge financial risk. I mean, this equipment that I bought is not cheap at all. And I've heard about other people who have opened up their own imaging centers and that have failed. So it causes me a lot of angst, but I really think that in the end of the day, if you provide something that's of use or has value to people, that they will come and that they will understand the mission. So I'm hopeful about this.
I think that's so important to kind of always go back to the why of when you're doing this. Cause it's funny. I was just talking to my girlfriend about this and a friend and saying, like, oh, do you want to go off and do your own thing? And they say, no, I do not. Like, I want to be able to end my job at 5 o'clock and I want to go home. And I was
Yep.
sitting there and thinking about me being an entrepreneur myself. I'm thinking, there's part of me that wish I wanted that. I get that stability, but I don't know what it is, but there's just something that wanna create change at a bigger scale, and it's more stressful, but if we think about why we're doing it, the outcome can be so much greater and so much fulfilling for us. And, like, why do you think that is for you? Like, why do you think you crave to do something bigger than what you currently were before?
For me, I think it's just something in my DNA. It's something I enjoy doing things that challenge me. I'm always looking for a challenge. I'm always looking to make things different. That doesn't come without its challenges, though. I always tell the story of how when I was in medical school, I used to fantasize while I was studying all the time that I just was going to get a job at a Walgreens and just scan the candy, like the candy and the magazines at the counter, and that would be my dream. And that's what I really want to do, and I envy the thought of being able to do something like that and just be okay with that and show up, punch my card, go home. But that's just not the way that I'm built. I wish it was.
And since you've been doing this as you're building up, how's your sleep going?
It's somewhat non existent. Yeah, I don't sleep very well at all these days, but I never have. So, luckily I get by on very little sleep.
I asked this question because it's super important to be transparent because there's a lot of doctors that listen to this. They're saying, I want to become entrepreneurs, understanding that it's not all rainbows and unicorns. That, like, every time you go to bed, you're like, oh, there's something I could be working on, or I have an idea that came into my head. And that's just part of the process. And I think sharing that is really important. So let's break down
Absolutely.
the mechanics of your business structure here, because I'm really interested to see how this works. So
Sure.
concierge, meaning someone is paying out of pocket for this. And is it
Correct.
going to be a flat fee, or are you still working out your pricing structure?
So for me, I'm just going to charge a flat fee for imaging. So if somebody comes into my imaging center, one of the things that's really important to me is being transparent. I know, at least for me, when I go get medical care, I'm frustrated that I don't really know how much it's going to cost. Medical care is the only thing where you walk in the door and you could be spending $30 for a copay for a visit, or maybe it's going to be $3,000, but you have no idea until you actually get the bill from the insurance company. So what was important to me was to have transparent, very clear pricing about what costs what. So when you come into my clinic, if you get a screening mammogram, it's $349 out of pocket. The thing about that, and is I know that screening mammograms are free for women with insurance, and I understand that. But part of what I'm offering is you get same day results right then and there while you're there. And in addition, for the screening mammogram, that also includes the cost of additional images if you need them. So you don't have to come back another time. There's no additional charge if we need a better workup or we need more mammogram images, we need an ultrasound. That's all done on that same day. I've talked to women and they're getting charged from insurance between $1,500 and $3,000 for those additional images. So in the end of the day, I feel like I'm providing a valuable service and may actually be cheaper when it all comes down to it.
Wow. Okay. So help me understand this process. You go in, you get the
Sure.
screening mammogram, and then if that's positive, then you have to move to a diagnostic mammogram. Is that how it works?
That's absolutely correct. So we get additional images of a particular area that we see that's interesting. We might get some spot images to get a better picture of it. From there, if we still see something, I send them to ultrasound, and then we ultrasound that area to see if we can find something that correlates. If we find something that correlates, a lot of times we'll watch it over time or say that it's benign and that she doesn't have to worry. In some cases, she'll go on to need a biopsy if it's something that we don't know what it is.
And is that something you're going to offer yourself?
Yes. Yeah, I bought all the latest and greatest technology, which I'm super excited about. So we will be able to offer biopsies, ultrasound guided, mammogram guided, CT guided. I've got all the latest and greatest technology. I'm super excited.
Okay. And so within that diagnostic process, what is
Mhm.
included in that $300 to $400 price range?
So that includes your screening mammogram, your results. It includes additional imaging that you may have to have, and it includes all of that. So it includes everything at your visit that day.
Wow. Okay. And then, but not the diagnostic mammogram. I just want to clarify. Is that
It includes
different?
the di Nope, it includes the diagnostic mammogram and the ultrasound as well. So what you're coming in, you're paying a flat fee for a screening mammogram, but it includes that additional imaging should you need it. Now, sometimes you're not going to need it. So you're paying for that mammogram and you won't need that imaging, but sometimes you will. And that way you just don't have to worry about the extra cost involved.
It seems like a no-brainer. It really does. And then we when we are thinking about when we're offering something to someone, there's cost, but then there's value. And the value that you're offering is the transparency and the peace of mind. And if
Correct.
someone says, "Is my peace of mind worth $400?" Like, yeah, it's a no-brainer. Of course it is. Absolutely. And so is the goal for it to be that they come in annually, once they reach a certain age?
Yes. Yeah. I want to see women annually, especially after the age of 40. I'm also extremely passionate about women under the age of 40. I've seen super aggressive cancers in women in their 20s, and these women haven't missed their screening mammogram. They simply have a finding they can feel in their breast. Once you feel something in your breast, it's progressed enough so that you can feel it. That's what we don't want to happen. I'm offering different kinds of screening for women that are younger than the age of 40 so that we can get started a little bit earlier. I'm offering formal risk assessments so women can come in at the age of 25, figure out what their risk is of breast cancer, and then sit down with me and figure out some kind of structure for them for screening. So they may start screening at the age of 30, they may start screening at the age of 25. I want women to have better access to care. I don't think that we should wait until the age of 40 to start looking at our breasts and worrying about breast cancer.
It's so cool. What is your
Thanks.
vision for this? What is your vision for this in the next 3 to 5 years?
I hope that more people jump on the bandwagon and do things like this. So, one of the things that I'm able to do doing my own clinic this way is I'm able to offer technology that takes hospitals a really long time to offer themselves. Just because, hospital systems aren't excited to jump on newer technology until they know that it's proven and that it's amazing. And frankly, that it's going to make them a lot of money. And for me, I bought all the technology that I think is the best to detect breast cancer and all the latest cutting edge stuff. And I'm excited to offer that. I hope more people will do this. I really do.
It is one of the advantages of being small, and it comes down to innovation, is that you have the
Yep.
freedom to move around and try these new things, whereas they are gonna be stuck in their ways because they have exactly what you're saying, those processes that are involved. And so I think it's really cool to see you making this kind of transition because we know that healthcare is having its challenges and people are getting fed up with the insurance, with no transparency in pricing, with the limited time that they get with their doctors. Now,
Yes.
one of the biggest concerns is that doctors are now leaving the traditional healthcare model and opening up their concierge model. Do you
Yep.
think that's gonna end up leaving a big gap for those patients that can't afford something like this?
That's a great question. And I've struggled a lot with this myself. How I see it is a little bit different. So, concierge medicine essentially opens up the concierge system to people who want to do that. But then it also frees up the healthcare system that we have to serve people who need healthcare as well. So, I think it actually is an advantage on both sides. You're essentially opening up more avenues for healthcare and you're freeing up the system that's broken and the system that's overloaded to perhaps be able to take more patients and be able to provide that care. So I think it's a win-win, honestly.
Okay, so it's like providing it's almost like supporting the public sector with the private to
Yeah,
to disperse the huge inflow of patients that currently the model can't handle.
correct. Our
Okay.
system is not set up to take care of our entire human population in the United States. So I anything that we can do to free up more healthcare, to add more healthcare, I think is a bonus.
Yeah, absolutely. And so as you build this out, I think it's really important because one of my favorite books is The Physician E Myth. I don't know if you've ever read it, but it's
No.
basically talks about how when doctors go off and they do their own thing, they go one of two ways. One,
Mhm.
they create a business that revolves around them as the sole provider, and they pretty much are creating a job for themselves. And then
Mhm.
two, they're the ones that build a business around it. So when we're thinking about what are the systems in place that I need to do to eventually become the CEO of my company or to hire other staff, for you, are you looking to create a job for yourself where you just have autonomy and freedom, or do you want to scale to something bigger than that?
As I said, I'm not a person that does things small. So I want this to be bigger. I'm hoping to, put this model in different places and, I go to different cities. So no, I'm just not looking for a job. I'm looking for a new way to practice healthcare.
I love it. Have you already started doing any hiring at all yourself?
Yes, I've hired all of my staff. They start this coming Monday, which is crazy and scary and exciting. Yes. Yeah, I have my mammo techs. I've got an ultrasound tech. I've got a front desk receptionist, and I've almost hired a nurse. So I'm excited.
That's so cool. And then, so when are
Yeah.
you hoping to accept your first patient?
So we officially open our doors on July 17th. So that week, July 14th, we'll be opening our doors to the public.
Okay. All right. And so
Yeah.
what does the marketing look now? Because you want to start building some anticipation for this. What kind of things are you currently working on as you get ready for this opening?
That's a great question. So we just did a hard hat tour last night. So I had a number of different physicians from different specialties come in and see our clinic and see what we have to offer and then how we can help their patients in the area, the kinds of new technologies we have that other people don't have. So I'm talking a lot to physicians. I'm, doing some TV interviews, some magazine interviews, and I'm just trying to get the word out as best I can that we're here, we want to help, and we're out there.
It's really, really cool. And I think it's going to be the cool thing is that once patients get in and they see your system and they see how much better it is, it almost can become a self referral system because a woman, you want to start building a community here, a community of women that want to be passionate about early detection and supporting those other women around them. And it's really cool to think about you have the ability to create that community starting at this business.
I want to do that so badly. I love taking care of my patients. I love women, but I really think that we need to spend more time and more money investing into women's health care, and this is just a small way to do that.
So cool. I love that so much. So there are other doctors out there that maybe want to make the shift. I don't know as big as you right now. There's
Sure.
some out there
Sure.
for sure, but there's some that
Sure.
want to do it. What do you want to tell them about the steps that they should take if they are thinking about doing something like this?
You have to step out of the box. So I know that it is, some people just want to go to their job every day. And again, I admire physicians and healthcare systems that are working every day and that are doing everything they can to take care of patients. I don't want to take away from that. But if people want to do things like this, you have to step away from the traditional healthcare model to do that. And it's okay to do that. It doesn't mean that you're not caring for the same population of people. It just means that you're changing the script about how to do it. And I started small. I created my own kind of remote mammography company, and that's how I started before I opened physical Shero. And that's been great, and that's really helped me understand that you can be very successful and productive as a physician being outside of the normal healthcare model. I can still help patients. I don't need to work for a large healthcare system to do that.
What were some things that you learned from that first digital monitoring system or business that maybe you can apply to this business now?
I learned that I'm not great at business and that it takes completely different skills than I actually have. I will say that my husband is a lawyer and an accountant, and he's been instrumental in helping me negotiate contracts into learning business skills. I think that's really, really important. As physicians, we're not taught any of those things. We have no business background. And a lot of us think that we're so smart, it's easy to learn those things. It's not, it's a whole different science in itself. So, learning about business, how to run a business, what it takes to run a business, how to manage money, those are all things that people can do and to start getting better at those things to go out on their own.
Wow. Yeah, that is a really cool complementary skill set that you 2 have for sure.
Yes. Yeah, I'm very fortunate I have that. So he often, will be he's the yin to my yang. So he's amazing.
So cool. So, if someone's listening to this and I'm sorry, where are you located again?
I'm in St. Louis, Missouri.
Oh, St. Louis, awesome. Okay,
Yeah.
so
Yeah.
if anyone's listening to this in St. Louis, if you're a provider, then please start looking at Shero Imaging, especially for
Yay.
those women. But if someone is just listening to this and wants to learn more about you or reach out to you, what's the best way to do that?
Lots of ways. So www.sheroimaging.com. I've got a website. I'm on social media as well. I do some TikToks, which, I'm slightly ashamed to say, but I do it and I actually love it because I think that's a great way to reach people. And I think that's kind of where people under 35 get a lot of their information. So I strongly feel that more physicians need to get on social media and start doing outreach in that way. I'm also on Instagram, Facebook, all of those other places as well.
That's amazing. Well,
Yeah.
honestly, I think that you are transforming. This is a very, very bold and cool idea, but the idea that someone can go and get access to this level of care, this is the future that we want to create. And this is the disruption that we need. So I so appreciate you. I know it's going to be hard, but it's
Thank
going to
you.
definitely be worth it. You got this.
Thank you so much. Thank you. I'm excited to get to talk about it. I've been keeping it inside for all of this time, so it's fun to go out and discuss it.
Oh, it's time to spread the message. Amazing.
Yeah.
So I
Thank you.
appreciate you having you on. Thank you so much.
No, thank you.
So if you are a healthcare provider, doctor who is working on building your brand, building your business, and if you have a story to share, please reach out to us, medstorymedia.com/podcast. We'd love to hear from you. Until next time, we'll see you in the next one.